How you doing?
Good. How are you?
Good. How's the day going?
Not bad. I actually had some space in my day because I think a few meetings got rearranged or what have you. So
Did you take a walk outside?
I did not yet. Right after, well, after this, I have two more meetings. So
Okay.
then maybe I'll get outside. Is it nice? Have you been out?
Yeah, I
Especially
have
the,
been out. Yeah. I took a walk around the Square One area,
oh, cool.
and the mall is packed. There was a lineup, so I didn't go in.
Ah,
Yeah, yeah. I just looked at the lineup and I'm like, I can't go in. It's not worth it. So, but a lot of questions.
okay. Let's get started.
Right. Burlington has been in the red zone for a couple of weeks now. When do you think we'll get into the orange, or is that the next color that
That
is?
is that is the next one, and probably not anytime soon. We are starting to see a slight uptick across Halton in our numbers. We are over the 40 per 100,000
Uh,
threshold, even for red. We were way down, and then it's starting to creep up. So it's kind of hovering a little bit over the 40. So we need to send that in the other direction
yeah,
again. And of course, you've got the variants of concern that are out there, and those spread more quickly. They're more damaging. So we really need people to continue to follow the health measures. And as much as things are reopening, the advice from our medical officer of health: if you go to a restaurant, for example, only go with people in your own household. Notwithstanding, you can have small group gatherings. Our medical officer of health is saying, try to avoid that, even if you're keeping your distance. So, and certainly when you're inside or outside and you can't stay 6 feet away, to wear a mask, wash your hands, all of that. So it's really important. Now is not the time to be visiting with friends and neighbors. And, we really need people to continue to only go out for essential services. That was the message we got from our medical officer of health, or we're going to be in this for longer. And I think
sure.
we all want to get out of this, and we certainly don't want to go backwards to gray or lockdown. We want to move towards orange. So I think we're in it for another little bit, and but hopefully we can kick this to the curb.
So there's no way we would, sorry, Burlington or Halton would go back to gray. You guys are in red, so you guys are staying in red, right?
As long as our numbers don't go the other way, as long as we don't have a third wave, right? And they're starting to creep back up. That's my point. So we need to send them back the other way. Just the last little while, they've started to creep back up again after we were doing so well. So if that continues to go up, then we know what's in our future. So we need to reverse that trend.
Okay. With the Halton vaccination clinics opening up last week, have you seen any hiccups in online bookings, calls, hotlines?
Phenomenally well done,
Nice.
actually. And that's the feedback we're getting from people who booked an appointment. It was very easy, it was very streamlined. There were no lineups, nobody was waiting outside in the cold, it wasn't crowded. They have really locked this down and to make it as pleasant as an experience and seamless and easy. Plus, if you need transportation, it will be provided free of charge. So
Okay.
when you book your appointment online or call 311, and you will get free transportation uh, to get to the clinics.
So wait, anybody can get free transportation to the vaccination centers?
Absolutely.
Yeah. Oh, okay. Awesome.
So
Okay.
when you call, if you don't have a way to get there,
Yeah.
the Halton region, who's handling obviously the vaccination clinics, they have partnered with all of the local cab companies in
Okay.
Halton. So here, that's Burlington Taxi, and they will cover the cost of your fare if you need a cab ride there and back.
Nice. Okay.
Absolutely. And there is bus, there's handy van, there's friends who will take folks. So there are other ways to get there. But our hospital clinic is opening on Friday. Our Compass Point Bible Church is opening on Sunday, and we're ready and ramping up.
Is any other region doing that?
I don't
You know?
know. I don't
Okay.
know.
I haven't. I've never heard that. So that's yeah, that'd be great.
Well,
So
you know what? We kind of forged the way. We're leaders.
yeah.
So we break new ground on all kinds of things. If it's never been done before, you can count on us to think about it.
Well,
and
I'll be
hopefully
bringing,
do it.
I'll be bringing it up to the mayors of Mississauga and Brampton.
Yeah.
See what they say.
Okay. Yeah, let me know.
Let's talk vaccinations. And I hate to sound like a broken record, and I'm sure you're gonna be sounding like a broken record over a couple of months. Who can get vaccinated now?
If you are 80 and older anytime this year.
Okay.
So that means you were born at some point in 1941. You don't need to be 80 on the day you book your appointment, but you need to be 80 sometime this year. And once we get through all the folks who are 80, then it goes down to 70, then 60. And plus, there are also additional essential service workers, frontline workers in each phase. So phase one, which we've complete, was long-term care, congregate settings, essential, the frontline essential workers like hospital care workers and such. Phase two is 80 plus,
Yep.
and still frontline essential workers, but a different category. We're getting some of our police officers and firefighters and so forth so are being vaccinated there. And so the whole grid, I know I'm getting questions from people, well, I'm 78, when do I get mine? Or I'm 62, when do I get mine? The framework is all on the Halton Region webpage in terms of the phases. So you can look at each phase in terms of when you are eligible. Are you phase 1, 2, 3, 4, 5? And it obviously we can't say, we're in phase 2 now, but we can't say like phase 3 is starting on this date, because it is all dependent on vaccinations and getting through all the folks in phase 2, obviously, before we move to the next phase. So that's all determined by the province. The federal government is responsible for getting us the vaccines. We're really just the messenger on this and making sure people can book their appointment and get there when they need to. So
Cool. And where the
so stay tuned. Stay
Stay tuned.
tuned.
Okay.
If you are not 80, stay tuned. I can't tell you just yet when you will be able to book your appointment. We are asking people not to book if they're not in the eligible category. So don't go and, I just really want people to know that we will, our goal is to vaccinate everybody. That was my battery. I think I
Oh
have
no.
to plug in.
Go ahead. Go ahead.
Okay. Give
Go
me
right
a
ahead.
second. I'm so sorry.
You're not on CP24. Don't worry. I'm gonna take a sip of my tea.
All right, I am back. My devices are all fully charged at the beginning of every single day, and around this time, because I use them so much, they start running out of juice.
What percentage? What percentage were you at?
I think I'm in the red. I'm in the red.
Less than 5.
And now this is going to be awkward because the thing is at the bottom. I'm trying to figure out how to get this set up properly.
Yeah. Don't worry, take your time. I'm gonna take a sip of my tea with my Hawaiian mug.
All righty.
There we go. You good?
I'm gonna sort of, there we go. All right, that's
Okay.
not too crooked, and it's not gonna die on us here. So, oh, for heaven's sake.
So tell us about where the vaccination sites are.
So in Burlington, it's at Compass Point Bible Church, which is North Service and Brant, and also at Joseph Brant Hospital. So the pandemic response unit is not being used for COVID patients, thankfully, and they don't need it for overflow from the hospital. So they've turned that into a second vaccination center. So we're the only city in Halton right now with 2. Yay.
Nice. Okay.
And now, having said that, you can go, if you're a Halton resident, you can go anywhere in Halton. So I know for some of our folks who may live in the northeast part of the city, it may be closer for you to go to Oakville or even Milton. So you have that option when you book your appointment. Whatever is closest to you, you can go if you're a Halton resident.
And I know I asked this last week, but region hopping for a vaccine?
No.
Absolutely not. Okay.
No region hopping. Yes. We ask people for their postal code. And,
okay.
And then when you show up, you have to present ID.
Okay.
So we will know if you've entered a fake postal code once we see your ID. But they want to make sure that you're in the eligible category, obviously, and check off that you've attended your appointment. So they'll match up your ID to your booking sheet.
Okay.
So yes, don't book if you're not eligible yet, and don't book if you're not a Halton resident. Go to the health unit in your own district.
Cool. So at full tilt, let's just say once you have, a lot of vaccines, and what does full tilt look like in Halton or in Burlington per day?
I think it's 10,000 a week across the Halton, the whole Halton. Yeah, so 10,000 a week across the whole region. So that's at all. There's there will be 5 locations in the initial stages, but that will ramp up as we get more vaccines. And of course, there are plans down the road to have pharmacies be able to dispense these, but that's further down in the process. So once we're at full tilt, we have been advised by General Hillier of the COVID task force to prepare for 10,000 a day. Some districts, 10,000 a week. Some will do well more than that. Right.
Okay.
I mean, in a place like Toronto, you're probably going to be closer to 400,000 in a week, more locations, more people, and that sort of thing. But the minimum that they're asking every single public health unit in Ontario to prepare for is 10,000 a week.
So I'm just doing my simple math that I'm probably going to be wrong at. If it's 10,000 a day.
10,000 a week. So it's about over 1,000 a day.
Oh, it's 1,000 a day?
Yeah.
So wouldn't that take 500 days to administer the entire Halton region? Is that?
Well, some have already been done.
Yeah, okay.
Right? And so,
sorry, I'm not good at math. Never do math on the air.
But that's a minimum, right? That's not, as I said, there will be places, but you need something to plan for. That's a minimum. So if you get more vaccines and have more locations, like places, bigger cities will, bigger public health unit districts will. That's the same number for, Muskoka. It's the same number for Simcoe. It's the same number for everywhere. So recognizing that some public health districts will have more vaccine, more locations, will clearly go well beyond that.
True.
The minimum for everybody is 10,000.
10,000. Okay. So let's just say, I know General Hillier has said June 20th is the date that he's hoping that everybody in Ontario is vaccinated. Let's just say that does happen, right? Are we going to have events in Burlington in July and August?
So events in Burlington, if they're large scale, they take a year to plan. Okay. So we already know, for example, that Sound of Music is doing something different again this year. No, they're not putting on the 4 days of festival. They would have had to start planning that in September. So will there be smaller pop-up type events that can be put together more quickly? For sure. We'd be open to that, and people can plan for that. But the large scale events that people are used to take a year and a half to plan. And you have to be absolutely certain it's going to happen. It can't be, well, we're hoping by June, we missed it by 2 months, and your event is affected, because you have security deposits, you have people you have to pay, you have, you can't just pivot on a dime for some of those bigger events, which is why we're seeing some of them announce already that they won't take place. For example, the Association of Municipalities of Ontario conference, it's in August. They've already said it will be virtual this year. They're just not even taking that chance, because we would have had to, they would have had to reserve and book hotel rooms already, and if people don't use them, there's a cost for that. So I think people need to understand the planning and the deposits and the outlay of money that would have to be done right now with that uncertainty ahead of them. And a lot of these organizations have already been pummeled in 2020 because all the investments that they made in 2019 before the pandemic, they lost that.
True.
Because they didn't have events in 2020. So I think we'll see a slow emergence, but I think what we're going to see is much smaller scale pop-up type events that people can put together very quickly.
Cool. Patio applications are now open in Burlington.
Mm-hmm.
Tell us about that.
So we've started the process earlier than usual, and I see people out on patios. Really, I've never stopped seeing people out on patios throughout the pandemic, even in the winter. But certainly, I saw a whole bunch of folks out in the last day or two. And so, if you have a patio permit from last year and you haven't changed anything, then it's very straightforward. Just come in, get your permit renewed. We have a grant program, so your city fees would be covered for that. So come talk to us. If you are applying for a new permit, that'll take a little bit longer, but you know, we're committed to getting it to folks so they can get up and running as soon as the nice weather hits. But really, it's here now, right? Like I said, I see people out on the patios in downtown Burlington, you know, bundled up, but they're drinking and eating. You know, we're Canadians, so people are doing it.
Awesome. City Council recently expressed their support for a new master cycling plan in Burlington. Tell us about that, please.
So it's a refresh or a revision, really. The last time we looked at our cycling master plan was in 2009. And so this was several years in the making. It's extensive consultation with the community. We have a cycling advisory committee. There was a consultant that was brought on to do some data analysis around where do people want to go and how can we get them there by bike. And so they built a grid system downtown. They looked at a spine system that would be east-west across the city of Burlington, and also looking very seriously at finally getting north-south connections across the QE, because it's very dangerous now if you're a cyclist to try and cross the QE on your bike. You know, you have to pass the turn lanes and the exit lanes. The bridges in some cases aren't high enough. So if you're on a bike and you're, you know, like, don't hit a pebble, because you know, we don't want you to go over the side. So it's really not ideal and safe. And we want to have a connected city. We want to make sure that people in the north can get down to the south and vice versa on their bike. So that's one of the things that is in there. And so you can see the whole proposed plan and the different types. There's different types of cycling features that are being proposed depending on the roadway. So on high traffic, high speed roads like Fairview, like New Street, there would be completely separated bike lanes, separated from traffic. There's also connector lanes that would be, you know, a buffered lane. So it's paved, but enough space for you to ride, but it's slower. It's a residential area. So there's all kinds of different types of cycling facilities, and that's all laid out in the plan. And picking the right one for the right street or the right area of the city is also really key. So we expect it will be roughly $5 million a year. To over a number of years to start making headway on that. So that will be part of our upcoming budget discussions.
So you think maybe a few years type thing for for the plan to be fruition?
5 or 10. Well, especially for the QE, because we'll need other levels of government support and permits and help. So there's some that are, you know, the low-hanging fruit, if you will, that we can just do. There's some actually already being planned. So where we have existing road work already underway in a capital project, for example, Plains Road, that's one of the spine parts of the network. And in our most recent 2021 budget, we put aside $3.6 million in additional funding for that roadway work to add protected bike lanes. Nice. So where there is already a capital project underway, that's where you get the most bang for your buck. You save money if you can tag on the additional costs of the cycling facility. So we look for those opportunities, and we can seed some of that through our capital budget without adding too much more in the way of new funding. But the QE crossings are sort of standalone projects. Those are going to take some time to get the permits, get the funding. I'm really excited for those ones, but some are going to happen next year, and some will take longer. So, cool. 5 to 10 years. Is that a good range? You can hold me to the range.
Awesome. It was recently announced that Burlington is supporting 26 charities with new pandemic response grants totaling 146,000. How will the city continue to help the community recover from the effects of COVID-19? Sorry, I
So
have to read
this,
that.
yeah, no, that's a great question. So actually, that's our Burlington foundation, the community foundation. That is not the city of Burlington taxpayers. We of course support that, and we're very happy to see that. The foundation is part of my COVID-19 task force, and a number of the other members, social sector charities, other groups that sit around that task force table would be recipients of that grant. But the foundation has received government funding as well as personal donations matching some of that. So they've been able to really leverage local dollars to feed back to local organizations in Burlington to
Yeah.
continue to do their great work. So it's a great news story. But yeah, we can't take any credit for that at all. It's not a city initiative.
So yeah, it's just more of a question here. It's been 365 days tomorrow since the pandemic was announced by the WHO. What has surprised you the most, and what have you learned the most in the past year?
So it's been the most challenging year of my life, certainly of my career in politics, which is now in its 10th year, but
Yeah,
it's also been the most inspiring. And the toll, the challenging part is the toll that it has taken on, I can say me personally, but also this is reflected throughout our community on our physical health. We're sitting more, we're sedentary, we're not exercising as much. In some cases, we couldn't really at all, unless you were out walking, but people weren't getting the same activity. Of course, our social calendar has been obliterated, and it simply isn't the same doing a call like this versus being able to get together face to face. There's a mental health toll, there's an economic toll. The devastating impacts over the last year on all those areas of our life, personal, physical, mental, economic, has been staggering. And notwithstanding the supports that have been available, and we're so grateful to the federal and provincial governments, as well as the city of Burlington, who has kicked in, hard cash for our businesses and our residents. There's still a big gap, right? There's still a hole there. So we are planning a day of remembrance uh, for people who have died because of COVID in Burlington. We will lower the flags and do a special proclamation. We're also planning some, information to go out to the public on the anniversary of the date that I declared the state of emergency in the city of Burlington. That's the 21st of March. So that's coming up. On the other side, though, the inspirational part has been just seeing people come together and across the city, organizations, businesses have come together in completely new ways and forged these incredible relationships that will last well beyond the pandemic, to make sure people were fed, make sure people could get groceries and get to appointments. We have a Facebook page, Burlington Together. There's 12,000 people on that Facebook page, and they are now. It started as COVID. Does somebody need a ride? Does somebody need groceries? Are you under quarantine? Here's who can help, or I want to volunteer. It started that way, but now it's, hey, I'm looking for a tutor for my kid, or got any recommends for somebody can, do good hair and nails. And it's turned into a really great source of information and a community forum, and that will last
true.
well beyond COVID. Neighbors have come together in new ways, to plan Christmas lights or what have you. I mean, the inspirational stories that I have encountered over the past year, and again, uh, those relationships are going to last beyond COVID. That infrastructure of community resilience, togetherness that has been built will last. And I've also seen the businesses come together. Our Team Burlington, which is ECDEV, Chamber Tourism, and our two BIAs, they've come together to provide a one-stop shop for businesses. They've advocated to all levels of government for funding and gotten it. and advocated for a number of business supports, and that will continue.
Nice.
And even post-COVID, they'll continue to advocate on what businesses need. So that's been a great partnership for those businesses. I sit on the Burlington Economic Recovery Network, which is that group, as well as some citizens around the table, and my fellow councillor, Kelvin Galbraith, is there. So that's been the inspiring part. And we are absolutely stronger as a community, and will continue to be stronger and more resilient, adaptive. You know, seeing people pivot and do the same sort of connection, but in a new way. That's been very inspiring. So that's what a year of COVID has been.
Do you find from a political angle that all the political leaders, mayors, premiers, prime ministers, you guys communicate more and more frequently?
Oh, absolutely.
Yeah.
Absolutely. Regular contact. And so for personally, the relationships that have been forged with my fellow MPs, MPPs, as well as ministers. We have direct access to ministers. I have direct access to the Premier, not so much the Prime Minister yet, but we have great MPs, members of Parliament, who take our message forward. So those relationships have strengthened. We always had them. We had good working relationships before the pandemic, but it's become essential, not a nice to have, right? We have to work very closely together, not just on COVID matters, but other matters that pop up, right? The life of the city carries on. And so there's other issues. And so those relationships are very strong. We support each other, and we respect each other. And that's a way of showing respect to the voters who elected these people. So you put party politics aside, and you say, well, the voters chose these MPs, these MPPs, this person for Premier, this person for Prime Minister. So we are required to work together. They've chosen us all, and they expect us to work together to get results, and we're doing that. So I hope that will continue beyond the pandemic, that we leave party politics at the door and we just work together.
Awesome. So are you gonna text the Premier now saying, "Can we get that bridge for the bikes?"
I might have to. Yeah.
Just message him.
Well, he likes infrastructure programs, so I might be able to interest him in. This is a great capital program, and consider it sort of mini development.
Yeah. Okay. Awesome. So, anything else you'd like to chat about? We have 2 minutes left.
We finished our budget.
Cool.
Last week,
okay.
Seems like a year ago. We are sitting at 2.5% increase overall. So there's a city portion of your budget, there's a regional portion, and there's a school board portion. All three make up your taxes. The city portion is about 1.85% of the total bill. But your taxes for this year will go up 2.5%, and we have added a whole bunch of great things despite the pandemic. So we've continued the seniors free transit during off-peak hours to the end of the year, and we will most likely just make that permanent in 2021 budget. We added more resources for tree maintenance. We added more resources to our planning department because notwithstanding the pandemic, we have 93 current applications on the go. 93. Wow. Complex, big applications. So we needed to increase our resourcing in the planning department so they could actually deal with those and not get buried. So we're open for business, and the life of the city carries on, and and lots more good stuff. Lots more good stuff in the budget. We really did focus on, and my personal focus was, let's add frontline staff and services, because that's what matters, is a direct service delivery to the community. So that was what I was looking for. If we were going to add, if we're going to justify an increase, that's where we're going to add, and that's exactly what we did.
About 40 interviews later, it's still a pleasure to talk to you every week.
Awesome. Yeah, 40, eh? Wow. I guess we missed a few. Yeah. It's not been quite a year yet, but yeah.
Crazy. But thanks so much. In Halton has reached 10K for Instagram followers, so we can now swipe it to your interviews.
Awesome. Good for you. That's great.
Well,
Sounds
always a
good.
pleasure. I'll catch you next week.
Okay, see you next week. Bye
Bye.
bye.